Hi, I'm Jeremy Crosby.
And I'm Nick Boucher. We're your hosts for the program that's all about your city, Talking Fitchburg.
Every weekday, we pull together the news, events, and information you need to stay on top of what's happening in the city of Fitchburg.
Find Talking Fitchburg on cable TV, Roku, Amazon Fire, Apple TV, and our live stream on the web. Plus, you can find all our headlines and stories on Facebook, YouTube, and our video on demand service. This is your city.
Keep up with Talking Fitchburg and the issues affecting you and your neighbors.
Want to know what's happening in your city? Get Notify Me messages from the City of Fitchburg. Visit fitchburgwi.gov on your computer or mobile device and select the big Notify Me button on the left. Enter your email and/or phone number, whichever is best for you to get notifications. Scroll down the list and select all the topics you're interested in to receive email or text messages about. You'll be notified every time one of your topics is updated. Sign up for Notify Me, one more way to keep up with your Fitchburg government.
Okay, this is the Commission on Aging Well for November 13th. The first order of business is to approve the minutes. Hopefully you've had a chance to look at them. Are there any additions or deletions to the minutes? If not, do I hear a motion to approve?
I make a motion to approve the minutes.
Can I get a second?
A second.
All in favor?
Aye.
We jump right to public appearances, Jill, so why don't you tee this up for us?
Oh, yeah, agenda items, actually.
Yeah.
So we were lucky to have Katie, our case manager, and Amy, our social worker, here today to just give an overview of the case management program, just talk a little bit about that, talk about some client cases, just to give you a better idea of what their days look like. So happy to have them here. All right, who's kicking her off?
Again, I can't really see it, but.
Oh, it's up there.
Yeah. So yeah, Fitchburg Senior Center Case Manager, yeah. I am a licensed social worker and Katie has experience in case management as well.
Here, Amy, I'm gonna have, you wanna talk like,
Okay.
yeah, and then you can
You
just
wanna
do the
switch it?
arrows. Yeah,
Okay.
then you can talk to the crowd.
Right. And what we do, our primary goal is to provide adults with information, referrals, and support and advocacy needed to remain safe and independent in their homes.
Can I ask one quick
Sure.
question?
Yeah.
What's the difference between a social worker and a case manager?
I'm licensed by the state of Wisconsin.
Our job duties are the same,
Okay, it's
but
all
she's
about
got
licensure?
letters at the back of her title.
Got it.
Yeah.
Okay, thank
I
you.
have a
Could
degree
you-
in social work.
Could you tell us your history with the Fitchburg Senior Center?
Me?
How long? Yeah, both of you.
Sure.
A little bit more about yourselves.
Sure. I'm starting on my 21st year
Wow.
at the senior center, and before that, I worked in various settings. I started out in foster care in the inner city in Philadelphia,
Oh,
but I'm originally a Madison native, so I am from Madison, and I just lived out east for 10 years. And then I worked in a hospital setting, in a nursing home setting, and then I came here. So I have kind of a broad view of all the different areas that older adults reside in. I will say that coming from a nursing home to the community was a little bit of a shock because I thought, how are these people living at home? Like I couldn't believe it because I saw such a different side of people and services that they need. But in Dane County, we're really fortunate to have all the services that we do to kind of piece everything together to keep people living independently, and it also saves the county a lot of money too, keeping people at home.
Katie, how about you?
So I've been with the Fitchburg Senior Center for not quite 4 years. Prior to that, I was with the city for 5 years in their court department. So I did case management for families and juveniles. Prior to that, I spent about 12 years doing case management for older adults and people with disabilities here in Madison and then in Chicago. In Chicago, I was an elder abuse investigator in Cook County for several years.
So a question for you. You said there's a difference between social worker and caseworker. What's the role of a social worker? Can you give us just a brief overview of the role of a social worker?
Like what we're doing
Yes,
here?
yeah. In general, social worker in general.
Well, as a social worker, we both provide case management services.
Okay.
So our role is to keep people independent at home for as long as possible, putting together the pieces, like whether it be food, home chore, documents like a healthcare power of attorney, financial power of attorney, linking them to, Medicaid and Title 19 services. Just all encompassing. We focus on the person and look at everything else that can bring them support in, and we're that link to providing that support.
What is Title 19?
Medicaid.
Thank you.
Speaking into the air.
Medicaid.
It's Medicaid, yeah. Mm-hmm.
Thank you.
Did that answer your question,
Yeah.
Anne?
Yeah.
Okay.
So who we support, people 50 and older who are Fitchburg residents. They must live in their home or apartment or condo or with a family member here in Fitchburg. We don't support people who are in nursing facilities or CBRFs, other licensed facilities. So they need to live independently in their home for it to be under our umbrella of case management.
So someone in assisted living you would not be able to support?
No.
Okay.
So I'm just going to talk a little bit about why we do 50 plus and not 60 plus for case management. So the criteria was set forth by Dane County, and we follow that criteria of 60 plus, not serving people in skilled nursing facilities, CBRFs or RCACs, and they have to live in their own home. It goes in together, but we're only reimbursed to serve 60 or over because that's connected to older Americans of funding. But for us, our county funding is probably maybe 15% of what it costs to keep the social workers paid, and you guys here. So because over the years we started to see this gap of people over 50 needing some support, whether it's just information and referral, which oftentimes that is, because we are city funded and we are city employees, we can choose to serve people 60 and under, which we're seeing more and more and more of. And I think, maybe we can mention a couple younger people that you're serving. The problem is, which we ran into, is transportation and meals. Those are county funded directly. And so we are not able to refer them to transportation or meals because that's 60 plus, but they can still work very closely with older adults, people over 50, who might need housing information, who might need a connection to the ADRC, if you guys want to fill in.
Yeah, well, some of the housing, our senior housings are 55 plus.
Right.
So there's this gap where they're in the buildings and we're there quite a bit and they reach out to us and need assistance, but they don't technically, we can't have them come to meals without them having to pay full price.
Right. But they are able to, if they have their own transportation and they want to come and participate, they can do all of that. So this didn't used to be such a problem as it is now, being connected with the county and having these criteria and not being able to report hours to the county of who we're really serving. It's getting more difficult to justify our time because we're not allowed to send forth those hours. We are only allowed to send forth hours of people that are 240% below poverty, and as well as people in managed care organizations, which is the in-home Medicaid. So they're the primary provider. Even though we serve those folks, we can't share those hours with the county. So it's probably more information you need.
And we ran into that
Right.
with one of the people we
Right.
invited to the open house.
Right.
It was 57.
And they couldn't use
They couldn't use the bus, and they couldn't,
come
and they
for
had to
lunch.
pay full price for the meal.
Right, but Katie did help this client in some other ways.
Yep, and he can still use our foot care program. He needed that. There were other just odds and ends that he was needing help with that we were able to help him.
Right.
Yeah, but it's
With the
very
main things.
confusing
Right.
It is.
to him and to me.
Yeah.
Mm-hmm.
So.
Can I just ask clarification? the acronyms at the bottom, SNF, CBRC, and RCAC. Maybe everybody knows what it is, but I have no idea what they are.
SNF is a skilled nursing facility, and a CBR
Okay.
is a community-based residential facility, so assisted living. And then the RCAC is a residential care apartment complex where you can go from apartment to an RCAC and get a certain number of hours every week. It's like 34.
Do we have any of those in Fitchburg?
Yes, the Waterford is an RCAC. I know they tout themselves as assisted living, but it is not.
Okay.
They are classified.
Okay, because that's what I thought it was, assisted living.
Is Quarry Ridge an RCAC?
No.
Okay.
Thank you. I just didn't know what those letters were. I'm like, okay, I don't know what this is. Thank you.
So this is a little bit of a breakdown of some of the people we support based on their demographics.
May have to say it out a little bit, like just primarily.
So our,
What are?
go ahead.
You don't know the race.
No, I was going to ask what the letters mean.
Oh, okay.
Katie will say what they are.
For our primarily caseload is white older adults. U is unknown.
Those are probably phone calls, so you don't ask.
Yeah.
Okay.
They call.
Yeah. O is other, K is Korean, I is Indian, H is Hispanic, F is Filipino, B is Black, AO I think is Asian other, and then Asian. That is what our database has broken it
That's
down
the
in that
county's
way.
criteria.
Yeah.
Yeah. That's how
I can't say for,
And I would assume,
go ahead, Mons.
go on, I'm sorry.
I was gonna say for our caseloads where we are doing active case management in 2014, I just pulled those numbers from those. There were 368 clients we served in 2024. 292 were white, 61 were Black, and 15 were Hispanic. And an active caseload is where we have goals set, we have a case plan. We have lots of people that we serve as case managers who maybe don't fit into that criteria. You know, people who come to lunch or people who maybe just need help once in a while or get a phone call where we're helping them for like a few days or a week to solve an issue, but might not need a full case plan and goals set and a criteria. So
Did you say, I mean, the county puts forward, we have to do 2 services or more.
2 services or more.
Can you describe what those might be?
It can be like home delivered meals, case management, transportation. So that's what identifies and separates. And they also have to be at an income level as well. So that was who we would put on our 610 to report to the county, but we have many more that are not reportable that we identify as case management.
plenty of high income people who need help that we serve, that we cannot report them for billing to be reimbursed.
Did you say the income limit was 240% below poverty? What does that number look like? That has no meaning to me.
Darn near zero.
No, actually, it's around 30,000.
Okay.
Yeah, isn't it, guys?
Yeah, for a single
It's like
person.
31,000 for a single person. So it's not, but you know, when you look at rent and you look at the cost of living. So, and that really, when I started years ago, there was no limit. We could report everybody. And I think it really was pushed by Madison because that was all that they could serve. And it was a strange situation in my eyes why it transitioned to this. And then the county also not having enough funding. So, you know, they didn't want us reporting everybody because they don't want to fund everybody who might have an income. Over the years, the county has looked at us charging for case management services. Like it's a wonderful thing that the county supports this because they don't have to. At any moment, this money can go away. It's not mandated at all for case management. So we just go along with it. So now their money is dwindling. They can only really reimburse focal points for serving those under the 240% poverty level. But the city there is picking up the cost of having staff here to support our community. Verona broke away from Dane County, I would say 15 years ago. Verona supports their case management program 100%. 100%. They get no funding at all from the county.
Wow.
Yeah, so pretty impressive that their community picked that up. And it's because of all of this, all these hoops and all this reporting and everything, so maybe the day will come. Okay, sorry.
I put these numbers in from 2025, so for a single person, it's actually 15,650.
Okay.
Yeah,
Oh, family of 4,
and then for
okay.
a family of
What?
33,000, yeah.
15,000?
Yeah, 650,
Where do you live?
yeah.
No, I believe
That was
Don't
on
get me
I was
started
gonna
on
say,
housing.
Yeah, exactly.
I'm sorry, I thought the single person was 33,000.
I did too, that was my mistake, Vance.
Yes, yeah.
Wow.
I don't think I made a mistake on that.
We'll get back to you if it is. All right.
And then where do we get the referrals from? Everywhere. Family members, churches, neighbors.
Property managers is a big one. We have a lot of really good relationships with different property managers throughout the city, and they call and say, hey, this is going on.
And physicians too.
So,
Physicians.
speaking of property managers, I've heard of conversations that there's turnover of property managers all the time. And you said you have good relationships. How does that work? Once a property manager is there, what do you establish a relationship and learn who's all in the building, or how does that work?
We make a relationship.
Yeah.
I mean, there's a lot of turnover in some of the senior buildings, and a couple in particular, and then as soon as we know there's a new person, I go over and I introduce myself and I give, I sit down with them usually several times, and I'm in the building a lot, so they see us, they get to know us, and then they understand, oh, we're helpful, so they end up calling us quite a bit, yeah.
Do you get referrals from Meals on Wheels drivers who might spot something and say, well, we better talk to the social workers about this?
About the person that they're delivering the meals
Yeah.
to? Oh, yeah, they report back if
I
there's
know
something
sometimes
going on.
I will stick my head in your
Yeah.
office and say, I think you ought to check on
No,
this.
we encourage that, that's great.
So those are people who we're already involved with, but it's all, I mean,
Good point.
the volunteers are the eyes, we don't see them every day.
Yeah.
So if someone's declining, it's, we could call and they say they're fine, but then we can, so it's
And
nice.
just another side note about the meals. So MCO is managed care organizations, and those are when somebody is at home on Medicaid, so they're receiving services from an agency of their choice.
Like My Choice or I Care.
Yeah, or I Care. So this is a Medicaid provider, so they're doing everything in the home. We are delivering meals to those folks, but come January 1st, because the funding is so limited, and all the details that go into working with managed care organizations, all of these MCO clients will be pulled off of our home delivered meals and therefore managed by their provider. And what does that look like now?
Well, for one
It's
client,
terrible. It's
they're
just
delivering
terrible.
meals from, I think it's probably a company called Mom's Meals, and they deliver in bulk. So for instance, I signed one of my clients up for that this summer. They come like 2 weeks at a time. Now, who has room in their freezer, in a tiny apartment freezer? So I had to order this person a freezer. I purchased him a freezer, but then the company delivered the meals to the wrong door on a 90-degree day.
Yep.
Those meals sat out for 3 days. Ruined, gone, grant money, down the tubes. So that's what all these people are having to face now. Where to store it, who's gonna carry it, where are you gonna put
And
it?
then
Who
just
gets
preparing that.
These
on
are
a
people
daily-
on managed care organizations like family care, people that go on family care. And they're on Medicaid, and they're part of an organization, and they said that they can no longer receive the meals. So these people will start getting meals from contracted providers, not us.
But we lose that
Yeah.
door to door. We lose
Yeah.
that check every single day on our most frail
And frail
clients.
people, yeah.
And I don't want to speak badly of the MCOs, but they're short-staffed. Sometimes they're hard to get a hold of. We still, again, are managing a lot of the folks on MCOs kind of as more higher level of accountability, because
Right.
we might see someone, you know, particularly that's getting meals, and you say, well, they haven't opened their door for 4 days. So then we have to call the social worker with the MCO, who might not call back. And then maybe they'll say, oh, so-and-so went in the hospital. So we're not the main provider, but I just think this is going to blow up. I think that our most vulnerable are going to be left to fend for themselves in terms of trying to figure out where the meals are coming from, and they're frozen. And again, there's no wellness check. It's really disappointing.
So they're frozen meals that they have to prepare?
Yeah.
Well, you
That
put
they
in the
put in the
microwave,
microwave.
yeah,
But
yeah.
last week I had a gentleman, he's 92, he was at the Veterans Day,
yeah.
talking with him, and he said they're gonna switch me over. In January it started switching, so they're getting the phone calls now. And he's in a wheelchair, he's homebound, he needs home delivered meals, and he's at Highline where he has to wheel himself downstairs. He can't even get to the door when people deliver the meals.
Yeah.
And is expected to carry a week's worth of food upstairs.
Yeah.
We figured out a way
That's
where
crazy.
it will be delivered to his son will take it over.
But that's just.
We're lucky he has family. A lot of people don't. They
Right.
don't have that,
So
so,
they don't deliver it to their apartment,
No.
it's just to the
The
address?
mailboxes, yeah.
yeah.
Mhm.
That's something.
So she lives in she has moved, but but if there's no elevator, there would be no way for that person to get down to the front door too.
Yeah, and
No.
that's one of the persons who will no
Yeah.
longer get the service, yeah.
Mhm.
So what's the decrease for Meals on Wheels in Fitchburg as a result of this? I mean, we're already seeing some of our numbers down.
Right. Well,
What's
Older
the
Americans Act.
projected decrease?
Older American Act funding hasn't kept up with the increase in older adults needing nutrition. And so the county has thrown in funding over the years at the USDA grants. I mean, there's other pieces of that pie, but the main one is the federal. So as the need has increased over the last 10 years, you've seen this huge increase in older adults needing services. Funding from Older Americans Act has not. They just reauthorize it at the same levels. And so it's starting now, it's tricking, you know, the feds aren't giving the states much, the states don't have much to give the counties, so cuts have to be made. So the MCOs, the managed care organizations, which was interesting to me because they actually had to pay full price to Dane County for those meals. So while somebody else can give a donation, they had to pay the 14 something. So you would think like, okay, they're at least covering the cost, but the administration of all of it, the county doesn't have the staff to administer, keep track. I mean, as you know, there's a lot of paperwork in government money. So they made a decision to not serve MCO clients. So, okay, doom and gloom.
Keep going.
Mhm. How we do our jobs. Yeah, we respond to referrals by conducting home visits. We implement a case plan based on the client needs, and then we monitor ongoing process to ensure the needs are being met, and that varies every day. Every day is a little bit different.
Can you go into a little detail about what a case plan is? What does it look like, or how that's set up?
We're
Or will you do that later?
Sure, we're identifying goals with the client, identifying goals that, you know, they are also in agreement with. It could be the client lacks nutrition, so the goal is to come to the senior center for lunch or to get a home delivered meal. It could be that they are isolated, and the goal would be to provide like somebody to come and visit or to come to the senior center for social needs. So that is, I mean, those are just easy goals. Those are very common goals that go on a case plan with our clients.
One
Okay.
common recently is I can't afford to live.
Yeah.
So we set them up with, see what benefits they might qualify for and get them involved with different programs, energy assistance. This time of year, we do a lot of those applications. We help with Medicare Part D, see if there's a more affordable medication plan, things like that. So some of the things we can help set them up with, home chores, a program, we don't really have the hours for that one, but we can say meals, transportation, housing, that's tough. We're overrun with people who need housing. I'd say every week, Amy and I get calls about people who need help finding affordable housing. It doesn't exist. We partnered with Joining Forces for Family and have started a housing clinic. So every other week, I'll go over to the Boys and Girls Club for the Allied Food Drive, and along with a couple volunteers and JFF, we help people search for housing. So it's nice, we can refer people to that, so we're not spending all day, every day doing housing searches for people. Go ahead.
What's some of the results of that program? That started last year, right? The two of you
Yep,
started.
just about a year. I mean, it was slow. We're figuring out what we were doing in the beginning, but I think we've kind of hit our stride. So we can't do emergency housing. We don't have, there's no funding. There used to be funding through the county and other agencies where we could get people help with security deposits or things like that. That doesn't exist anymore. So mainly it's different housing wait lists. We can sign people up for them. Yeah, just other apartments that maybe they don't have access to a computer. There's one that has some subsidized housing. It's not affordable, but it's slightly less than market rate. But you need to have an email address and you need to have a computer access to even get on the waiting list. So we help with that. So sometimes it's setting them up with an email so they can then be put on a waiting list. And that's very time consuming. So that's
So time consuming. Yeah.
So do you know in the end whether or not they received housing or what?
the housing clinic, we do not, that is not a case management clinic. So no, we don't,
You don't keep the data
I
for
don't
that.
keep their personal information, you know, because it's social security numbers, it's all sorts of things that they need to apply. That is strictly a walk-in, we'll help you while you're here. And that housing clinic's for anybody, it's not just older adults. And it's for, you know, it's at the Allied neighborhood, so there's a lot of people who are not Fitchburg residents who also come to that. If people are walking in, I will gravitate towards if they're an older adult and try to help them. But that's not always the case. I'll help anybody at those clinics. But at least it's something we can let our residents know, hey, come to this and we can help you, so.
I've kind of lost track of the construction or the discussion around affordable living. Is there hope on the horizon? Is there anything under construction today that is targeting affordable housing?
I mean, they're calling it that.
I was getting ready to say.
Yeah,
I
hear that in
They
the
are
discussion.
building quite a large unit over by Quarry Ridge that's going to have a lot. I mean, maybe Donald will remember, it's over 100. And they're saying, it's sort of like Highline, there's, you know, different percentages that you qualify. But again, how are we defining affordable? It's just not there, and there's no Section 8. It's just, it's really a crisis, and it's gonna get worse. And it's kind of scary and sad.
Yeah.
Mm-hmm.
Speaking of housing, just another quick question. So when you say you have people that come to you, they can't pay their rent, or they need housing or whatever, but oftentimes you hear seniors saying, I can't afford this. They keep going up on my rent. They go up on my rent. How do you guys deal with that when someone comes to you?
Try to cut their budget if you're able to.
Half of them don't really have a budget. I mean, really, think about
Cable,
it. I mean,
phones.
Some of the benefits that we could, like, they've never applied for energy assistance. You know, there might be services they just don't know exist. They're drops in the bucket.
Right.
And I mean, I have a gentleman I'm meeting tomorrow. His rent is $1,100. He makes $1,500, and
yeah, we hear that all the time. Yeah.
yeah, they got to cut out underground parking if it exists. If they have a car, a lot of them need to sell.
Give up their cable, give up their regular phone, get a government cell phone. I mean, it's just like piecing things together to be able to afford to stay somewhere.
Right.
It's a game.
And oftentimes it's
Yeah, but
you know.
Do you have
can I
any
say something real quick?
sir?
Oh, wait.
Oh, sorry.
Oh, that's okay.
Somebody.
Go ahead, Donald.
Yeah, no, I was just you were just talking about some of the construction that we have. Like Jill did tell us a project that we have that is related to affordable housing, and then we do have some future ones on the horizon. The tough part about adding these, as you know, is for a developer. Yes, you get kind of the state subsidies and things like that for providing this type of housing, but again, it's more profitable if builders build things that are market rate. So we have been working with people who want to bring different type of housing structures here and try to get a certain percentage of those units to be affordable. Usually somewhere in the range of like 10 to 15 units is what we've been seeing around trying to get some affordable, depending how many are in the, or sorry, 10 to 15% of the units in the buildings to be affordable. And then, of course, that fluctuates depending on how large the building is and how many units they have. And then how we calculate most of the, like, what is affordable housing. In Wisconsin, we kind of look at like housing that costs the household no more than 30% of their grossly monthly income. And then, as Jill alluded to, there's always different percentages of that, of those percentage of your grossly monthly income. And then when you get to the higher percentages, like the 80%, I can't remember the exact number, but we had a council presentation where we were trying to do something different with affordable housing, and the upper bounds of affordable housing, like around the 80% area, is almost creeping into the $80,000 a year range. So you can see that housing costs are getting so high at this point to where people which once would have been considered a decent wage or be able to support yourself and your family, is now creeping into that affordable housing range because costs are going so high.
And also with the housing, where you say how we support them, is we have had to help people transition into shelters. So we attended eviction court. Had to drop people off and show them the intake on how to go to a shelter. So I'm helping the gentleman now there's no answer, and he's gonna have to go through court and then be evicted. So we kind of hold their hand through that.
And there's no such thing as rent control in Wisconsin.
I think so. I mean, we've reached out on occasion to certain management companies the first step as a city, we're going to Lorraine or Mike and say, can't you guys control these management companies from raising rents? And they can't. And, it's really bad. It's really bad and sad. And there's not enough shelters. It's just.
The next question, is there shelter capacity to?
The county's building one right now. Strictly for men, I think it's 60 beds.
Yes.
And already, when they designed this, when they started the process, 5-10 years ago, they need 200 beds. So they're gonna open this and, it's gonna house a smidgen of, and it's just men. And so, so anyway, yeah.
So can I have another question? You guys talked about the variety of case management situations you have. Do you track like the number of people that you see that have housing issues or food insecurities? Is there a database with this kind of information, or?
We don't break down like what a specific issue is.
I don't have data for
share
that.
It's only on there's people on food share, so they might be food insecure. And we also track that on our nutrition forms for people who are getting meals. So it's tracked that way, but identifying every single person like a checkbox, no.
Yeah, no, I mean, that's one.
Yeah, no.
I just use it as an example, but in general, you guys have a variety of situations. Yes. So how, and you said you had 200 and something, so out of those 200, do you have any idea of how many had this? And it was here, you don't have that, okay?
No.
Okay, thank
Wouldn't
you.
it be multiple issues for
Multiple issues, Janice, usually.
Well, I get that. I'm sure there are some that are multiple issues, but there are some that are single. So I thought it would be nice to be able to say, hey, look, we've had 50 of them that were evicted, or I had to do this. So how do you know if you don't take a look at it from that perspective, you know, that,
Yeah, we don't
that
have
broader look.
the numbers, but I know that they have to put in, is it quarterly reports? With trends. And so we always have to say, you know, what are you experiencing, or what are they experiencing, or the needs? And so you can look back, and those all go to the county with all the 610 and all the other reports that say housing, 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 housing. You can watch the trends. So you can look back at these quarterly reports, you know, even over, I mean, we've always done quarterly reports for many years. So you know the trends, they're not technically backed by numbers, but that's a trend. I did get food share data from Dane County recently. They said right now we have 340 older adults, 60 plus, getting SNAP benefits. But that doesn't mean everybody, some of them are going to the pantries without SNAP benefits. And so it felt very low to me. I think we have a lot more people on SNAP benefits that aren't being captured. So
that's, you speak of Dane County as a whole.
Dane County. So
yes, I guess my question is more so about here in Fitchburg.
No, I'm sorry, Janice. These numbers are for Fitchburg. 340 in Fitchburg, older adults on getting SNAP, food share.
Okay.
But, yeah.
So who should you refer?
Yeah. All those issues. People over 50, things that you see, keeping their home clean, access to food, memory, finances.
So a lot of times, it's nice having Sarah, I know she was here the other week, having her as an in, because sometimes a neighbor might call police and say, I need help, check on, you know, she's wandering, or somebody walking down the highway. So then she'll call and say, hey, you know, this is a new person, or somebody we already know, but, so we've been getting more of those referrals as well.
And I don't mean to take over, but I thought this is interesting. So those SAMS forms that, you know, when you come and you eat once or 100 times, the county, the state makes you fill out a form, goes all back to the feds. There's a lot of questions there about food insecurity, and somebody that came for Veterans Day, you know, had checked one of the boxes saying, you know, something like, I have trouble accessing food. So this is the first time the person came to eat. And so, you know, as Mandy enters all that into the peer place, the database, then she alerted the caseworkers, like, this gentleman or this individual is food insecure, this is how he checked that box. And then there was another one too. So, you know, even though those forms are really cumbersome, they're helpful that way, because we wouldn't have known that. So anyway, yeah.
Questions?
Well, maybe we could talk about.
Yeah, they're gonna give some case scenarios now, just some snippets.
Can I ask a question to the folks in the room? Is there anything that isn't being done from a local government council perspective, specifically for myself, that we could engage in more or push the envelope on that isn't currently being done?
Transportation.
Yes.
We need transportation. So a big chunk of Fitchburg cannot access paratransit services.
Right.
It's been for years. It's been terrible.
And all walks of life, all income need those services, and they can't access them. So then these people cannot get to their doctor's appointments. It snowballs.
Seems like a reoccurring theme.
Yeah.
We need transportation.
Yes.
Even getting to our senior center, getting,
We
need accessible transportation.
So Donald, if you can pull a rabbit out of a hat on that one, congratulations.
You'll get the gold medal.
Yeah, we'll see what we can do. Transportation is just like if you watch the council meeting on Tuesday where we passed the budget, definitely know that that's a problem in Fitchburg, and are working kind of as much as we can within the bounds and confines of the money available currently to do those things. So definitely still working on creative ways to increase transportation for especially the most vulnerable populations that we have in the city.
Great. All right.
Anything else for these two?
Well, they're going to give it just a
Oh, that's right. You're going to give us some
case
examples.
scenario. Yeah, not scenarios, real time.
I'll just have a quick one.
Go for it.
Yeah.
Most recently, I've been dealing with a couple that I had to petition a guardianship for his wife, and she's now in memory care under a protective placement, and he is not the guardian. Well, he decided to get on a plane a month ago and ended up in North Carolina. He went to the airport and had somebody help him buy a ticket. He was going to try to live with his estranged daughter that was 7 hours from the airport. And he was wandering around confused in Charlotte, and they took him to the hospital. And I have been going back and forth with the hospital. They want to transfer him back here.
How did they find out about you?
The daughter. The daughter, first they got a hold of the daughter, and then the daughter called the apartment manager, who then called me. So I've been in constant contact with that hospital because they keep trying to transfer him back here, even though he's been found incompetent. You know, he's not his own decision maker. There's no decision maker for him. I refused. Well, I said I would not help him if they sent him back here without some kind of cognitive testing. Plus, he was non-renewed at his apartment, so he was also homeless. So, yeah, I just got an email this week. Will you take him back if we find a place for him? And I said no. He is not his own decision maker. You would have to go through the court process in North Carolina. It takes about 6 months. He would need a guardianship. Wisconsin does make it easy to transfer guardianship, so they would have to contact Adult Protective Services here in order to initiate that, but they keep thinking that I will go to the airport and pick this person up who's homeless and not his own person.
And no place to stay.
And no place to stay. So that has been, I mean, other people have ended up in other states as well, but not like this. So it's been terrible for him, and I know he wants to be near his wife, but it's just not going to happen. Challenging. Yeah.
So one of my more recent ones, I have a gentleman, he originally came to Fitchburg through the Hotels to Housing program during COVID. People who were in shelters moved into hotels, and then they were able to transition into housing. There was not really involved case management with any of that process, and that we slowly learned all these people are about to lose their housing because they didn't learn, or they didn't have any resources to help them live who were chronically homeless. So we've had quite a few that kind of fell on our shoulders, and now we're teaching them how to budget and where to get food and how to pay rent and how to sign up and keep your benefits. So this gentleman was part of that program. He does have some mental health issues. He had never been to a doctor that he could ever recall. So we helped him get set up with medical services. He's scared to go to doctors. He's kind of doesn't want much to do with anybody. At one point he was going to be evicted, and we were able to get him hoarding resources to clean out his apartment so he could stay. So he's been there almost 4 years now, and they have no plan to evict him anymore. I have had to take him to appointments because he was very forgetful and wasn't able to get there on his own, couldn't understand, some of the appointments were on the far other side of town, and he didn't have the wherewithal to be able to navigate that, and they were very important appointments. He had an MRI, and they found out, you're currently having a stroke. So he would not get into an ambulance. I knew that about him, or police. He's very triggered. So the clinic social worker called me and said, he needs to get to the ER now. So I went over there, I found him, I was able to get him to the ER. Turns out he has Alzheimer's pretty severely, and he has dementia. So I was able to coordinate with his doctor and then get him enrolled in an MCO. So that has recently,
MCO?
A managed care organization.
Okay.
So technically, I should now be done. That's not the case. I got a voicemail this morning. MCO caseworkers, the ADRC was calling saying, hey, about this benefit, about this. He doesn't have a phone. I am in the building all the time. He's over at Highline, and I leave notes on his doors. So they call me and say, hey, when you're over there again, can you leave a note to say we're gonna show up? And I do, because I'm on his floor quite a bit, and that's not an issue. But he comes to me when there's concerns because he trusts me, and his other case manager could not. I don't even know if they live in Madison. They see him once every 3 months. So, and that's their requirement, is
Once every 3 months.
once every 3 months, contact once a month. So even though we're not able to, bill him, but I'm still very involved. So that's one that's kind of happening right now. I have lots, if you want more.
Of your caseload, just generally, what percentage do you think has nobody other than you advocating for them? Is
90?
Most
Yeah,
have just nobody?
most, or some have families that just are estranged or not involved or should be involved.
Or out of state.
Yeah, so,
Yeah, I think I'm an emergency contact at doctor's clinics for maybe 4 or 5 people.
I am too.
Because they don't know who to
They
put.
have nobody else.
Yeah.
Well, thank you for this, and thank you for your good work. It's very much appreciated. What goes on behind the scenes that nobody knows about.
And I also appreciate you guys being so positive and compassionate with the clientele.
Agreed. Yeah.
That's got to be. I know you have hard days. Let's just say that. I was a director of student services, and my social workers and guidance counselors sometimes just need to get things off of their chest. And the stories they would tell me about the kids and their families, I want to, win $1 million and give everybody some money. I know that's not the answer, but that's got to be hard for you guys. So thank you so much for doing that. Wow.
Thank you.
Thank you, guys.
Thank you, guys.
Thank you, guys.
So, yeah, but it's just so different than it used to be.
Yeah.
And I was at a county meeting on Monday, and the Dane County Human Services Director, who's relatively new, he came from Social Security office. He was just talking about the cuts that are also going to be coming soon on the county level of a lot of employees, and it's just a difficult time. And the student intern that went to the housing clinic Wednesday came back and had helped an older adult, but she said I couldn't help her. There's nothing to do. There was nothing available. But I put her on wait lists, and I said that's all we can do. We used to be able to fix things, and now we just manage the chaos and hope that just giving them an ear to that somebody is here that cares. But you just can't fix some of these crises anymore, and it is disheartening.
Is it possible for you to ever refer any of these people to their legislators? To let them know what's really going on? And the impact of their decisions?
Certainly advocacy is important. I mean, I am a strong advocate at the county level, and I go to all the hearings, and I know that the Dane County executive budget did the 4% across the board for services, and that got reduced to 1%. So, advocacy does matter. I have taken older adults to give testimony, but at this point in time, unless you go to we can go to the Capitol. We used to go to the county, and that's all you needed to do, but now it's federal. Yeah. It's all federal, which is more difficult. But certainly people can, write Tammy Baldwin and Ron Johnson and see where it goes. But it's hard times.
And in Dane County,
you
have support.
Correct. Correct. Yeah.
But it's the people outside of Dane County who are causing the impact on Dane County.
Yeah, high up.
And they won't listen to you unless you have an address in their district.
Correct. So.
Report from Senior Center Friends is next.
I don't know where Gail is. I can say that they are funding, we had about 100 people come to the Veterans Day program. It was one of our bigger ones.
good.
We had Dan Connery, who is Dane County Veterans Services Director, talk about benefits for families and veterans. And then afterwards, we always take a photograph, and we had 36 veterans that took the photograph, which is bigger than we normally have. And then the friends always make a donation on behalf of a veteran and the guests. And so we counted 45 that they'll be making a contribution to the Dane County Nutrition Program on behalf of them. So their generosity continues. Trying to think, they had the 3 new members in October that started. Yeah, I think that's it that I know from the Friends standpoint, so.
Okay. Well, we'll keep it with you, Jill, for your director's report and the outreach plan.
Great. So just an update, just about the restructure of the departments. It got pushed back to an official approval date of December 9th. And so I technically haven't officially taken over and still doing a lot of information gathering. Just the way it got referred out and just taken a while. In the meantime, I have been working with a furniture company to bring down another desk down to the social worker's office with the intent of bringing on a social worker as well as Jessica Wolf from planning, who is the community outreach coordinator, in January. We received 12 applications for our part-time social work position. The city did support bringing that up to 24 hours, so that person could at least have the option of getting benefits, obviously paying, but as well as getting into the WRS system, hoping that would give us more applications. So 12 wasn't bad. We're going through applications today with the intent to interview on the 24th. I've asked Janice to sit on the panel, Amy and Sarah and I. Let's see about that. Been working with the company trying to get chairs and tables in the dining room, which is taking a long time, but if you want to come and sit on 2 sample chairs today, they're down in the dining room. And you know, I want the people that eat lunch to be able to sit in them and see what fits them best. So anyway, it just takes a long time. Same with the AV equipment in the dining room. Bids came back, so Jeremy's going through the bids again. So hopefully we'll get that wrapped up sooner than later. I do want to remind everybody the hub, which they're still naming, figuring out what the name's going to be, but the new community center gathering place across from Highline on Traceway, the grand opening is the 24th from 3 to 6. And so I invite you to come over. I did take a peek. I got a little tour. It's a beautiful space. So see where that goes. Let's see. Janice had an amazing lunch and learn last week. Yeeks.
Last week, Wednesday.
Yeah, last Wednesday. You gonna talk about that?
Yeah, it was, I had Wisconsin Sleep Center, UW Health Common, how to sleep better. It was great. We had like 74 people, 75 people there. It was amazing. A lot of really, really good information. Yeah. A lot of questions, whatever. It was amazing. Yeah. Yeah, it was good.
Yeah. And next week?
Well, next week is actually next Wednesday. A representative from the Ho-Chunk Nation is coming to do the history of Ho-Chunk. So
because it's Indigenous Month.
Indigenous Month.
Yeah. So that I'm really looking forward to that too. Yeah.
Also, Miss Mayoral Award recipient, congratulations.
What did he say?
Say it again, Donald.
I say you're also a mayoral award recipient, so congratulations, and we look forward to celebrating you.
You knew that, right?
Janice has been Janice will be getting an award from the city of Fitchburg.
Yes, thank you
for her volunteer work.
So
Janice will be receiving an award for all of her volunteer work.
Okay, so this is the second year that the mayor has created these mayoral awards, and she picks a city employee, she picks a business, I think she picks a nonprofit, she picks a community leader. Yeah, seems like one more. But anyway, this year, Janice was selected as a community leader.
Thank you very much. I mean, it was a surprise. I didn't even know she had those. She did
Yeah,
that every year. I had no idea.
it's relatively new, so.
No, thank you.
The press release went out. Donald, are you still on? Because
Yeah, he's there.
Oh, I don't remember when the ceremony is. Do you?
The next council meeting?
It's during the next council meeting.
Say that again?
The 25th at the council meeting.
25th at the council meeting.
Thank you for bringing that up. I'm sorry, Janice. I knew all about it. I got the press release and I forgot to add it.
I haven't seen a release.
You haven't
or
even
anything.
seen it?
No,
Okay.
no, I just been talking to the
because
mayor and.
Janice isn't only on the Commission on Aging, she also serves on 2 other committees, which are.
Janice, go get if you can, go get the Fitchburg Star. You're in there.
Oh,
they did a release.
Yeah.
Oh,
yeah,
okay.
Yeah.
I'm on the steering committee for the housing plan. I'm on the community equity committee, and I'm on the history wall. Yeah.
She's everywhere.
So, Well, thank you. It was a complete surprise to me.
I know.
I really appreciate that.
She said, "You know anything about this?"
I had no idea. It's like, what was going on?
Yeah. So thank you, Donald, for that reminder. So Vance, you got 9 for your wreath class, if you want to talk a little bit about that.
Ooh. So this is one of the things I brought to Jill a couple years ago when I started coming to the center regularly. I wanted to teach some classes. And I love, for those who know me, but I love doing crafts and arts. And so one of the things I've been doing in the last I took a class at Bruce and Company for some ridiculous amount of money, nothing personal, Bruce, to learn how to make a wreath. And I thought, anybody can do this. This is not rocket science. So of course, I taught it to a couple of my friends one year, and then a group of my friends wanted to do it the following year for Christmas. So I did it with them. So then I asked Jill, I said, I've done this wreath making for my friends. It wasn't a class per se, but it was teaching. How about doing that for a class here at the center? And she's like, oh yeah, fine. And this is back in May we started talking about this. Yeah. So originally thought November, but the greens weren't going to quite be ready that early in November. So it'll be December 2nd or 3rd, Jill?
December 2nd, 1 to 3.
It's $20 a person.
All supplies included. Fresh.
And we have a scholarship from
the Friends.
A particular. Okay. I remember a name being in there too, but I thought it was through the Friends.
I'm sorry, you're right. It's through the Bansell Fund, Memorial Fund. We have
Bansell Fund.
This money stuff. So
that's helping me buy the supplies.
Yep.
Yeah. And I'm really excited about it, but I'm always excited about making something. So
so we've got.
But it'll be fresh Christmas greens, and then we're gonna buy. I will buy a couple of picks, Christmas picks. So people have a variety of those to add to their wreath. They're literally getting a wreath frame.
Yep.
And then I'm going to show them how to attach the greens to the frame.
Yeah, we're not teaching the class right now. But anyway, there's 3 more spots available if you want to sign up. And then, if you want to mention, you have a great group in the Building Resilience. I looked in there yesterday.
Oh,
Did you have new people?
No.
Oh, okay.
No, there were 8, and it's been a little bit of a feeling our way through what works best, whether it should be a presentation or much more focused along the lines of the caregiver support group. And they seem to prefer that caregiver support model because no one really wants to volunteer to present anything. And besides which, it's not really that type of group. They're not going for information, they're going for support.
Support, right. And just a reminder, it's for folks that...
single, divorced, bereaved, widows, widowers, I learned yesterday at the women's group that one of the members had lost her daughter recently, and I didn't get a chance to talk to her, but I would think even anyone who's going through a grieving process would benefit from that kind of support.
Yeah.
So we had 8 people yesterday. We've got about 15 or 20 on the mailing list, but not everybody can come every time. And only 2 people have ever asked to be removed from the list. So
good stats.
Yeah.
It's just such an example of the engagement of all of you on this commission, and much appreciated from volunteering and meals. Each of you are doing something to give back, and that's great. So thank you. I think that's everything I have on my list. So. Okay.
Jump into outreach.
Yep, so you have those. I want to talk about the next working meeting, if we can pull out some calendars. We do have a commission meeting on the 11th. So we want to combine this working meeting because of the holidays, November and December. So to keep it on a Wednesday, I was thinking the 3rd, and I can follow up with an email so you guys have these dates. But I was looking at December 3rd, which would be right at the week after Thanksgiving. That's a Wednesday. We could do it the 10th. We'll have the working meeting the 10th, and then the commission meeting on the 11th, or we can push it to the 17th. But if it's easier for you guys, I can throw out a doodle pool. And but Wednesdays, at 3:30 was working pretty good, or 3. So
The December 3rd.
Jill,
yeah.
Jill, at one point you mentioned maybe combining the 2 meetings for the month of December just because of the holidays and stuff.
Well, that's what I'm talking about.
Or am I misunderstanding?
I'm combining the outreach, the working meetings, not the commission and the outreach, or the working meeting. I'm combining November, December. Yep.
Working meeting.
Okay, I thought I was confused. Thank you.
Yep.
Any of those Wednesdays work for me.
Any Wednesday?
The 3rd works best for me. The 17th, I am not around.
Okay, 3rd.
The 3rd works best for me too.
Okay. All right. Okay, I'll send out an email with that reminder. Okay. Wonderful, thank you. And then, we can talk about the luncheon tour then, that we had last week that had slim results. And but Barb's got something to share with everybody for the next meeting, so you can have this to look at if you want to explain what you got here, Barb.
Well, this is the launch. We'll try to email it to you.
Oh, yeah.
Thank you. And Donald.
Yeah.
Jeremy.
Yeah.
No, not Jeremy.
Okay, let me make a note so I get everyone.
Charles,
Vance, and Donald.
Yep.
Basically, it's just a hard copy of what what you all have sent me. So I'd like you to take a look at it and make any additions or corrections. The first is a calendar of events. They're not sorted by date. They're just kind of sorted the way I got the information. But I've tried to list what the event was, who was the responsible leader, where it occurred, who the audience was, how many people participated, and any remarks that we wanted to record. The next page is the initiatives, and we talked about adding that in terms of what things have we tried to do. For example, bulletin announcements, the talking points that Paul created, goodie bags, lunch and learn series, and so on, just in terms of things that we're doing that count as outreach. So if there's anything that's missed, and then the contacts, who the points of contact have been, and if there are any that are missed there. Janice, you had a point?
I had what?
Did you have a comment?
No.
Oh.
All right, so yeah, take a look at this before the next working meeting. If we're missing anything, we can add to it. Any thoughts, and then I'll think about anything coming up.
Yeah.
Yeah, because, yeah.
I guess I'll take that back. I guess we just have to make sure that we are not adding things into this outreach plan that wasn't in outreach plan. There's a difference. We're doing a lot of different things, but we've got a specific outreach plan that we started off with our mission and our goals. And so we need to make sure that we stay focused on that and that we're reporting on that, on those things that we identified versus adding other stuff to it.
So, I mean, the talking points, because that is one thing.
The talking points is part of an outreach plan to help them as they go out to the churches and what have you.
Well, so is this, isn't it? This is outreach plan, right?
No, that's not what I'm saying to you. Yeah, this is what this document, is that what you're asking? Yes, the document, I'm not speaking to the document in what you have in your hand. I'm speaking of what we put on the document, in the document.
Yeah, is there anything that you
For
noticed?
example, Lunch and Learns is not part of the outreach. That's not part of the outreach plan. That is a form of outreach, but that was not in our outreach plan that we put together.
So you don't want that?
No, I think we need to,
Okay.
what I'm saying is that we need to be careful so that we aren't confusing them. It just says with the ambassador stuff, the ambassador is outreach, but there's different types of what we're doing for outreach and what ambassadors are doing. All I'm suggesting is that we make sure we stay focused and clear on what we're doing. That's all I'm saying.
Yeah, well, this is what, I mean, this is good to talk about at the working meeting and clarify. You know, because, we are doing outreach, Lunch and Learns. We got the ambassadors still going out. They'll probably be at the hub. That maybe we just have an initiative for our plan and then
But that's what I'm saying. That our outreach goals.
I get that, but I understood from the beginning that the ambassadors were part of the outreach plan, because we talked about that, and so that's why they were.
I think it needs to be documented. I think that it's a different area, but it's
the
part
way
of
we said we were going to document it so that we are aware that they're out doing some things out there, but not that we're not adding in and saying, oh, this is what we're doing, because it's not what we're doing. They're doing that work out there. That was just to keep us aware of the fact that ambassadors are out there over at the farmer's market or whatever. So it's all outreach. There's a plethora of outreach things that's going on. We just need to make sure that we are identifying the ones that we put in our plan.
And she has it well identified, ambassadors, not us. Okay. Well, I think,
We can clarify that.
But and I'm only saying that because you asked me if I had a comment, so I just want to share that. Okay.
So, but it is nice to have a snapshot of what's going on, so thank you.
Okay. That's all I have.
Okay.
Anything else?
Donald, do you have anything from the city level?
Nothing major other than that we passed the budget on Tuesday, so that process is finally complete.
Good, that's a big deal. Okay, thank you.
We had a whopping $45 left over, so we passed a good budget for that I think we were really happy about.
All right, thank you.
Anything else from anybody?
Is it possible, like we had the social workers in today, case manager, that was really helpful in me understanding the breadth of their work. Is it possible that we could have Mindy come in and do the same?
Mandy,
I'm sorry.
Sure,
I apologize,
absolutely.
Mandy.
Yeah.
I think that would be helpful too, as far as, again, understanding, what they do. Thank you. I appreciate that.
Yeah, no problem.
So our next meeting is December 11th. Motion to adjourn today.
I so move.
I second.
All in favor?
Aye.
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 We're done.
All right.
Have a good one, Daniel.